Hello everyone, welcome to Pediatrics by Dr. Anand Bhatia. And hello everyone, is my voice audible? Yes or yes or yes. Is my voice audible to everyone? Let me check. Yes, exactly. So yes, good evening everyone. Please let me know if my voice is audible. My voice is audible. Can we start the class? Let me check. Oh,
Yes,
I can
exactly.
see.
So
I
yes,
can hear my own voice. Okay, great. Good evening, everyone. This is the beautiful Unacademy NEET PG platform, and in this segment, we're gonna talk about some amazing topic that is Down syndrome. Some 55 MCQs we have of Down syndrome. We're gonna talk theory as well as the MCQ. My name is Dr. Anand. Let's start the class. Can we start the class? Thank you very much. Yes. So, in the Unacademy, first of all, this is the last week. This is the last week. March, month is March, week is 5. We have some amazing educators. I want you guys to give all the tests as much as possible because it is good. Also, at the same time, we are launching this previous year question bank batch, which is always very important. Also, in the Unacademy, we have something known as Unacademy Lite. Take the light subscription and be happy in life. Light rahe, light subscription le aur ऐश करे. So that's what. And also we have launching this beautiful MBBS Prof 1, MBBS Prof 1 batch, which is always good for the students who are preparing for next exam. Also, anyone have any doubt can raise their hands or can get up only by themselves and say, Sir, I have a doubt. And we have this doubt clarification series also coming very soon. And also in the Unacademy, we have something known as Plus subscription, where you get amazing access to the classes live as well as recorded. Educators are good, and the Android, laptop, iOS, you can watch me anywhere, anytime. Also, we have the iconic subscription. In the iconic subscription, you have the Unacademy platform and the Prep Ladder subscription. And the Prep Ladder subscription. Hello, Dr. Osama, Dr. Priya, Vaidehi, Kritika, Shubhangi, Swaraj. Yes, good evening, everyone. How are you? All good? Kya kiya sham ko? What you guys did in the evening? Ate momos, ate pani puri, become fatty. So each 100 ml of breast milk contains how many gram of fat? Who will tell me? Okay, read and come. Okay. Yes, and also in the iconic subscription, you have the Unacademy platform and the Prep Ladder subscription. Congratulations to people who work so hard. And now I want you all, Vaidehi, Osama, Priya, Pragya, and amazing people who are working every day very hard. I want your faces and names to be there on this toppers batch podium. In the Unacademy, if you are new to Unacademy, download Unacademy. And most importantly, in the beautiful part of the Unacademy, you can make we can ask MCQs to each other. You can ask me any doubt because all the lectures are recorded, and you get the PDF file. Sir, notes, we want notes, you'll get it. Download Unacademy, watch the special class. There's a button of downloading the notes. Download them, okay, but don't sell them. Download them and read them. Okay, very good, nice. Also, we have made batches like a NEET PG Beautiful batch. Tomorrow I have a FMG class. Tomorrow evening 8:30 p.m. Tomorrow evening 5:15 p.m. If you guys are free, I have a class. Most importantly for FMG students, everyone is asking me, sir, please FMG के लिए batch बनाइए. So FMG की class कल है, rapid revision. If you guys are free, come tomorrow evening 5:15 p.m. Also, that's it. This is the NEET PG end of the year sale. 20% off. Just 2 months left. If anyone wants to take any pack, this is the duration. This is the old price. This is the new price. All you have to use is the code. We have a code, okay? Which code? This code will be little financially beneficial for you if you use this code, Dr. Anand, if you want to take a pack. That's it. Let's start the beautiful class on the Down syndrome. Down. Are you guys ready? Can we start the class? Thank you very much. Yes, exactly. Sonali, Anshika, Kritika, Vaidehi, Priya, Osama. Yes. So if you're a newcomer, that's great. And if you're an old student, I'm gonna ask you 1,000 questions. Try to answer. And if you don't answer, then you see this side I have a eclairs toffee, and this side I have a chappal. I have my chappal size is number 9. So let's see how you answer. Dr. Osama, I'm looking at you, and Savan, Sonali, Kritika, Anshika, Vaidehi, and Dr. Priya. Starting with every amazing segment, we always have a motivating quote, and today's motivating quote is, "What is courage? What is courage?" Dr. Osama Sheikh, courage का मतलब क्या होता है यार? What is courage? Like I'm preparing so well and I'm revising. Is that courage? What is the according to you guys? What is the meaning of courage? Shagufta, Praveen, Osama, Sonali, Anshika, just think for 5 seconds and tell me, what is courage? Kya hai? You're revising or failing again, or you're not able to crack exams, still you're trying again. Is that the courage? What is the definition of courage? What is courage according to you? So beautiful. Shubhangi is telling ability to work without fear. So proud of you, dear. Ability to work without fear is courage. I agree with you. Someone says, okay, Shazam says never give up. Yes, true. We have Doc Derm. He says no fear. So courage. Courage is the commitment. Courage is the commitment to begin without any guarantee of success. I don't know what's gonna happen. I have no idea. But I have a commitment that I will do it. I have a commitment, I will do it every day. I have a commitment, I will do no matter what happens. I will do it. That's it. मुझे नहीं पता कल क्या होने वाला. I don't know what's gonna happen tomorrow. But today is in my hands. Let me next 1 hour is in my hands. Next 35 minutes I'm gonna revise Down syndrome, and these 35 minutes are in my hands. Imagine guys, you're reading the topic, this topic for the first and last time in your life. So try to answer as much as possible and try to update your notes as much as possible. So very importantly, exactly. So Doc says, I don't know Hindi. No problem, dear. I'm speaking in English also. So courage is commitment to begin without any guarantee of success. And what is success? Everyone knows success is walking from failure to failure without no loss of enthusiasm. Success is falling, is walking from failure to failure. Sir, in my grand test one, I'm getting less marks. Sir, in the second also, I'm getting less marks. Third, sir, but in fourth grand test, I'm doing okay. Sir, fifth grand test, I'm much better. Sir, sixth and seventh grand test, sir, I'm much better. I think I can clear it. So success is walking from failure to failure with no loss of enthusiasm. Guys, please, you will get failure, but again failure. In the end, it's all success. So success is walking from failure to failure without no loss of enthusiasm. That's it. Great, Hema. Let's start. I'm gonna show you one very important video of syndrome, guys. So you have to tell me in the comment section what can we appreciate in this picture. Number one, Dr. Osama, just now tell me fast. What is this very important PG entrance question number one? What is this gap? What is this gap between the grade 2 and the second 2? Can anyone tell me what is this gap, dear? Exactly. This is nothing but the sandal gap. This is nothing but the sandal gap. And where do you see sandal gap? Everyone knows about it. Sandal gap is the gap between the of grade 2 and the second 2. Sandal gap, basically it is seen in Down syndrome. Remember guys, very importantly, it is Down syndrome. It is not Downs. It is Down syndrome. It is not Down, it is Down syndrome. Again, looking at the picture, can anyone fast and finish it off? Can you please tell me what are the points can we appreciate in this picture? Is this baby normal? Is this baby perfectly fine? What do you think, Osama, Swaraj? Exactly. Very good. Very good. So, can we appreciate? So, whatever you guys will say, I will write it. Okay. Anyone? Exactly. So nice. Nareshwar Pratap Singh Naruka. He says, very importantly, mongoloid slant. Can we appreciate upward slanting of eyeballs? Yes or no? Upward slanting of eyeballs? Yes or no? Exactly. So, upward slanting of eyeballs is nothing but very importantly known as mongoloid slant. Upward slanting of eyeballs is nothing but mongoloid slant. And what is downward slanting of eyeballs? Anyone? Downward slanting of eyeballs. Downward slanting of eyeballs is nothing but anti-mongoloid slant. Anti-mongoloid slant. Very good. So beautifully answering. So anti-mongoloid, where do you see anti-mongoloid slant? Can anyone tell me very fast? Anti-mongoloid slant, basically it is seen in Noonan syndrome, it is seen in Cry-Duchart syndrome, it is seen in Treacher-Collins syndrome. You do remember that? So Treacher-Collins syndrome, Cry-Duchart syndrome, and Noonan syndrome, basically, yes, you will see anti-mongoloid slant. And most importantly, where do you see mongoloid slant? Exactly, very good. Mongoloid slant, one of the very important feature, guys, is nothing but our Down syndrome. And someone very beautifully told, can we appreciate depressed nasal bridge? Yes or no? Can we appreciate depressed nasal bridge? Very good. Can we appreciate a flat facial profile, guys? Flat facial profile, yes or no? Can you appreciate mouth open and tongue protruding out? Mouth open and tongue protruding out. Mouth open and tongue protruding out. Yes, very good. पंखा चला दो, पंखा 2 नंबर पे. No, very good. So these are the beautiful features. Yes, yes, very right. So beautiful you're answering. So yes, these are the important features, right? See, photographic memory. Okay, please. So number one, I can appreciate a sandal gap, flat facial profile, and can you appreciate the way she's looking at the father, this patient, the way she's looking at the father? Is IQ normal in a case of Down syndrome? I think everyone knows about it. IQ is not normal. IQ is not normal in a case of Down syndrome. I think now we have come to a stage. Can anyone tell me now two syndromes? Can you tell me two syndromes where IQ is normal? Who will tell me any two syndromes where IQ is normal? कौन बताएगा? Nay, tell me two, not one, two syndrome where IQ is normal. So अभी आज तक तो I think Oscar also knows that Turner syndrome is a very important syndrome where IQ is normal. We have done this. एक और syndrome बता दो मैं मान जाऊंगा. One more syndrome. Can anyone tell me where IQ is normal? IQ is normal. IQ is not affected. Other than Turner, अभी हमने कुछ दिन पहले किया था. Few days back only we did. And my dear friends, I'll be taking water also in between because my throat is not well, and doctor has told me to take water continuously to avoid dryness of my mouth. So don't mind if I take water in between, okay? Because doctor has told me. Exactly. Yes, Shagufta Praveen, so beautiful, dear. Yes, Treacher-Collins syndrome. Very, very important. Treacher-Collins syndrome, also IQ is not affected. Sir, how will I remember, sir? Remember T and T. That's a TT. Treacher-Collins syndrome and Turner syndrome. IQ is not affected. Treacher-Collins syndrome and Turner syndrome. IQ is not affected. IQ is not affected. Perfect. So can we appreciate mouth open? Can we appreciate a large tongue? Or can we appreciate mouth open? है ना? These are the important points. Perfect. This also photographic memory. Photographic memory. Look at the picture. So can we appreciate kind of a mouth open, large tongue protruding out? Perfect. Perfect. Mongoloids land, yes, I saw epicanthal fold, guys. Did you see epicanthal folds? And very importantly, do you see single palmar crease in a case of Down syndrome? Yes, 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 yes. We see single palmar crease in a case of Down syndrome. That is also important. And sandal gap, I've already told you. Now, what is this? Can anyone tell me? Exactly. In fragile syndrome, also, Anshika is asking, not much, dear. I have seen patients of fragile X syndrome. The IQ is slightly delayed. Like I have seen the patient of fragile legs actually. Yes. So yeah, what do you call this? Can we write very importantly epicanthal fold? Yes or no? This is what examiner is gonna ask you. If anyone final year MBBS student with us, examiner will ask you this. What is epicanthal folds? So this fold is nothing but the epicanthal folds. It is the skin fold of the upper eyelid. It is the skin fold of the upper eyelid. Okay, covering the inner corner of the eye. Can we appreciate this line? Inner corner of the eye, आंखों का inner corner. It is the, can you read that line? Very important. It is a skin fold of the upper eyelid. It is the skin fold of the upper eyelid का skin fold है, which covers the inner corner of the eye, covering the inner corner of the eye. So never forget this. This is nothing but epicanthal fold. Exactly. So beautiful, Shubhangi Kaushik. Very good. Today you got rank 4. Yesterday you won 500 rupees. I'm so proud of you. And today Shubhangi thoda sa niche aa gayi, but it's okay, Shubhangi. That's great. But I'm really happy that you're trying your best. Osama also. You guys are really working very hard. Great. So now the points of Down syndrome, like we have a mnemonic. Down syndrome patient should always get an eye checkup. Down syndrome patient should always get an eye checkup. So we have the mnemonic is do eyes checkup alongside. Do eyes checkup alongside. So D, there are three D's. So everything is three, remember. Okay, remember, do you know, right? Trisomy 21. Na? So everything is three. So D. Number one, D for can we appreciate a depressed nasal bridge? Can anyone please tell me? Yes, exactly. Dog is asking audio class time. Dear, audio class time is 9:30 p.m. The link has already been generated. We have an audio class at 9:30 p.m. where I'm going to ask you cardio questions. It's free for everyone. Come, open the button, participate, talk to me. 30 minutes quick session will have on at 9:30 p.m. cardiology. Okay, it's only for the Android users, not for the iOS ones. Okay, perfect. Can we appreciate a depressed nasal bridge? Can we appreciate down ears? Yes or no? Like a low set ears? Yes. Can we appreciate down ears? And also, can we appreciate developmental delay? Can we appreciate developmental delay? So depressed nasal bridge, down ears matlab low set ears, and developmental delay. These things are over. Depressed nasal bridge, decrease IQ, nothing but intellectual disability, and down ears, nothing but low set ears. Okay. Yes. Perfect. E. Can anyone tell me three important E means eyes finding? Can anyone please tell me E, any finding? Everyone knows about it. Osama? Yes, don't mind. I'll be having water in between because my throat gets dry very fast. I must take a lot of water as I have been told. So what do you think, guys? E for hmm. Yes, Shubhangi Kaushik is very right. E for epicanthal faults. E for eyes, we have mongoloid slant, and very, very important, yes, we have something known as brush field spots in iris. Osama Sheikh, very good, bro, very good. Brush field spots in the iris, eye finding we have in Down syndrome, brush field spots in the iris. I'll give you one chocolate if you can tell me any other syndrome which has some eye findings. Can we link and study? We should always link and study. Can anyone tell me any one more syndrome वेयर देर आर आईज फाइंडिंग? कोई और सिंड्रोम है जहाँ पे आई फाइंडिंग होता है? ओके, डॉक्टर इज सेइंग ड्रिंक हॉट वाटर सर. यस ब्रो, आई एम ट्राइंग माय बेस्ट. हम्म. वेरी गुड. Very good. Williams syndrome. Who told Williams syndrome? Shagufta Parveen. Very good, dear. Williams syndrome. What do you have eye finding in the Williams syndrome? Do you have a star burst iris? Yes or no? Star burst eyes kind of a thing. Starry burst. Star burst हो जाता है. ऐसा eye का finding होता है. Star burst eyes or iris basically you can see in Williams syndrome. And very importantly, Osama Sheikh is answering so good. Have you heard of Warden? Hostel ka Warden? Very good. Have you heard of Wardenburg syndrome? So Wardenburg syndrome also, what do you have in Wardenburg syndrome? Most importantly, hostel ka Warden. What do you have there? Do you see heterochroma iris? Yes or no? Heterochroma matlab heterochroma iris means change in the color of the eye. Change in the color of the eye. Basically, you have one eye is blue, one eye is black. So change in the color of the eye known as heterochroma iris seen in Waardenburg syndrome. In Williams syndrome, you have star burst eyes, very important. And also, I'll give you a chocolate if anyone can tell me. There was one syndrome where you see aniridia. There was one syndrome where you see aniridia. Anyone can tell me aniridia कहाँ मिलता है aniridia? And anyone, what do you think? You have to open your brains on a very broader aspect, okay? And aniridia किसी जगह गलती से कहीं पढ़ा है हमने aniridia. And in one syndrome you have coloboma of the iris, coloboma of the iris. So now guys, we are linking and studying. Please, can you tell me aniridia and can you tell me coloboma of the iris? So have you heard of Horner syndrome? Yes or no? Horner, do you remember Horner? In Horner syndrome, what's the mnemonic? The mnemonic is Pamela, Pamela Anderson. Ptosis, remember anhydrosis. M for meiosis, E for enophthalmos, L for loss of ciliospinal reflex, and A for, you can say anisocoria also. Yeah, anisocoria also you can see there. Very importantly, yes. And also coloboma. Coloboma कहाँ मिलता है? Anyone? किसने बताया? Pragya Khare. Very good. Very good. Treacher Collins syndrome. Remember Gandhiji's three monkeys? It's a rapid revision. Okay, if you're a newcomer, please watch our previous videos. We have done one hour each on Treacher Collins, on Horner, on every syndrome. As the NEET PG exam is very near in INI, CT and FMG, so we are back to back revising. So aniridia, basically aniridia is seen in you can't see in Horner syndrome also, and coloboma of the iris, defect in the eye. Okay, so that you can see in Treacher Collins syndrome. That's what. Hi, hello Daleshwar, how are you, dear? Very good, perfect. Okay, so do eyes checkup, checkup. See, can we appreciate? Can you please tell me three C's in a case of Down syndrome? इसको क्या बोलते हैं? What do you call this? I forgot. I don't remember, यार. What is this? Can anyone tell me? Yes, very good, Sonali Patra. Very good. This is nothing but clinodactyly. Remember, have you heard of clinodactyly? Dactyly means digit. Clino means incurvature. Incurvature. उंगलियों का मुड़ जाना. Incurvature of the digit is nothing but clinodactyly. Number one. Very importantly, and can you see congenital hypothyroidism? Can you see congenital hypothyroidism? Yes, remember you can see. And which is the most common congenital heart disease? Which is the most common congenital heart disease in what do you call it, Down syndrome? Yes, very good, Swaraj, Priya, Shagufta, awesome. So yes, the most common congenital heart in Down syndrome is ostium primum. Ostium primum type of atrial septal defect. The most common congenital heart in Down syndrome is ostium primum type of ASD. And the most specific, yes, the most specific is nothing but endocardial cushion defect. The most specific congenital heart in Down syndrome is endocardial cushion defect. And the most common congenital heart is nothing but ostium primum type of atrial septal defect. So clinodactyly over, congenital hypothyroidism over, and and ostium primum type of atrial septal defect is over. Perfect, super, super amazing. And yeah, of course, I have told you just now, the most common type of atrial septal defect, basically, in a case of Down syndrome, is ostium primum, of course. In a case of Down syndrome, the most common type of atrial septal defect is ostium primum type of atrial septal defect. And in cardiology section, who will tell me in the cardio topic, the most commonest type of ASD is which type of ASD? Ostium secundum. Yes, ostium secundum type of ASD is the most commonest type of atrial septal defect per se in the topic of cardiology. But if I talk about the most commonest type of ASD in Down syndrome, the answer is ostium primum type of atrial septal defect. That's very important. Very good, Sonali, Shubhangi, Swaraj, Shagufta, Pragya, Swaraj again, and Osama. Awesome. Keep answering. Finish it off. 10 more minutes topic. Finish this topic. Okay, perfect. Yeah. So A. Can anyone tell me three important A's in a case of Down syndrome? What do you think? Anyone? Don't mind. I'll be having water because I'm having dry throat. I'll be having water. So three A's. कोई A गलती से मुझे बता सकता है इसके अंदर? Yes, very good. Yes, very good. Osama Sheikh is very, very right. Number one, yes, can we appreciate atlantoaxial subluxation? First and second cervical vertebra, there is an instability. There is an instability. Number one, atlantoaxial subluxation. Number two, very important, star mark, PG question. Can Down syndrome patient can have Alzheimer's? There was an article recently on it. Yes, Down syndrome babies को भूलने की बीमारी हो सकती है. Down syndrome babies can have a problem of forgetting things, so they can have Alzheimer's. Again, double star mark like a super speciality question. Which type of leukemias is common in a case of Down syndrome? The answer is acute promyeloblasttic leukemia. M7. Very importantly, M7. Yes, Dr. Osama Sheikh. Very good, bro. Very good. Acute promyeloblasttic leukemia. M7 is very important in the case of Down syndrome. Very good. Perfect. And also, O. What are the three important O's? What are the three important O's? By looking at this picture, my dear friends, what are the three important O's? You can tell me. Occiput. Number one is occiput. Can you appreciate a flat occiput? ये जो पीछे वाला, this one, dear. Can you tell me? Can you see a flat occiput? What do you call that? क्या बोलते हैं इसको? ओसामा कुछ नाम होता है क्या? तू Yes, do we have a name, guys? Do we have a name for the flat occiput? Do we have a name for this condition? What do you think? Exactly. Yes, this is known as turricephaly. This is known as turricephaly. T for turricephaly, T for tower head. Okay, remember that. T for turricephaly, T for tower head. So flat occiput is very important feature you see in a case of Down syndrome. Yes, Nareshwar is right. Open wide anterior fontanelle. Very good. Open wide anterior fontanelle. And how many fontanelles do we have? Can anyone please tell me how many sutures do we have in a newborn and how many fontanelle do we have in a newborn? What do you think, Dr. Osama Sheikh, dear? What do you think? Swaraj, Shubhangi, Ara Nishashri. We have a very nice, she's one of my very good student. Ara Nishashri, her voice is amazing. So yes, Osama, how many fontanelles do we have and how many sutures do we have? Exactly. Okay, Shubhangi says, that's right. Shubhangi is right. We have four sutures. Four sutures. We have metopic suture, we have coronal suture, yes, we have sagittal suture and we have lambdoid suture. We have four sutures, right? And how many fontanelles do we have? We have six fontanelles. We have six fontanelles and four suture. Remember that. That's again an exam question. So yes, we have a flat occiput known as turricephaly. We have a open, wide, anterior fontanella. Nothing but it is seen in Down syndrome and round face. O for round. O for round face. Round face. Done. Next one. Yes. So last one, do eyes check up alongside S? Can anyone tell me by looking at these pictures? I can answer. Can you answer? What are the S important here? Can we appreciate a simian crease? Yes or no? Single palmar crease or nothing but simian crease? Yes, very important. We can see simian crease. Very, very important and very beautiful photographic memory. Exactly. Can we see a sandal cap, guys? Very good, very good. So beautifully, Osama Sheikh. Osama ने एक वो भी दिखाया, फोटो भी भेजी है. So nice. Yes, very good. People who are amazingly answering are Osama, Shagufta, Arpita, Sonali, R.R. Nisha Shri, Naresh Pratap Singh, Naruka, and Arpita Pancholi. Very good, very good. So yes, sir, I can you see sandal gap? Yes. Can you see simian crease? Yes. Can you see short head? Yes. What is the other name of short head? Brachycephaly. Brachycephaly. Now, if brachycephaly has come, I have to ask you, brachycephaly is the premature fusion of which suture? Which suture is involved in a case of Down syndrome? You remember, right? Do you know we have various types of sutures? If I put this picture, if I make a diagram of the sutures, just now you told me, right? Just now you guys said, right, that we have the metopic suture, yes or no? We have the coronal suture, yes. We have the sagittal suture, very importantly, and also yes, we have the lambdoid suture. So, exact, Shubhangi is very, very right. So, coronal suture, premature fusion. See, many of the students do mistake in this one. That is why I'm stressing on this point. Many of the students do mistake in this one. So, premature fusion of the coronal suture causes what? Yes, premature fusion of the coronal suture causes something known as brachycephaly. Brachycephaly. And premature fusion of the metopic suture causes anyone who will tell me? Osama, मैं नहीं बताऊंगा, कौन बताएगा? Exactly, Swaraj. Premature fusion of the metopic suture causes, very important, trigonocephaly. Trigonocephaly, yes. And next, premature fusion of the sagittal suture. कौन बताएगा sagittal suture? This one, yes. Premature fusion of the sagittal suture causes Osama Sheikh, yes, nothing but dolichocephaly. Dolichocephaly. And what is the other name of dolichocephaly? Yes, the other name of dolichocephaly is scaphocephaly. The other name of dolichocephaly is scaphocephaly. Very good, Arpita, Osama, Swaraj, Sonali. Awesome. You guys will get a seat. People who are answering has a very, very high chance they will get a seat. And last but not the least, guys, can you please tell me premature fusion of the lambdoid suture? Everyone keep doing this one little wrong. That's why we are stressing on this point. Yes, premature fusion of the lambdoid suture basically causes yeah, it causes plagiocephaly. Plagiocephaly, right? Very, very important. So premature fusion of the metopic suture causes trigonocephaly. Premature fusion of the coronal suture causes brachycephaly. Premature fusion of the sagittal suture causes dolichocephaly, which is also known as scaphocephaly. And premature fusion of the lambdoid suture causes plagiocephaly. Has everyone understood this much? Please tell me yes or yes, yes. Or you can give a golden heart or a blue heart or a black heart. समझ में आया? इतना नहीं आया? 30 minutes are over. 10 more minutes and this class is over. Perfect. Now next point. Yes, very good, Swaraj. Now simian crease. Can anyone tell me single palmar crease or the simian crease other than Down syndrome? Other than Down syndrome, can we have any other condition? कहीं और मिलता है क्या? Other than Down syndrome, do we have any other condition where we see single palmar crease? At least one name. At least one name you can tell me. Very good, James. Very good, Arpita, Vilasni. Okay, very see Shubhangi. Very good preparation Shubhangi has done. So yes, other than Down syndrome, single palmar crease is seen in fetal alcohol syndrome, trisomy 13, congenital rubella syndrome, Turner syndrome, Klinefelter syndrome, Cry-do-Chart syndrome. All these, there are 7 syndrome. Remember, at least that the take-home message for the newcomers is that single palmar crease is not just seen only in Down syndrome. It can be seen in other conditions also, like fetal alcohol syndrome, trisomy 13, and rubella syndrome, and Turner syndrome, Klinefelter, and Cry-do-Chart syndrome. Let me ask you one question very fast of this everything. Cry-do-Chart syndrome, guys, what is the gene mutation? What is the which chromosome and which chromosome number basically, and which arm deletion is there in the Cry-do-Chart syndrome? Who will tell me? Anyone? Which one exactly? Yes, 5p. 5p deletion is there, and p is the short arm or the long arm? P is nothing but the short arm. And what is q? Q is the long arm. Q means queen. Queen होती है ना, queen बड़ी होती है. Queen is the long arm. and B is the short arm. Do you see microcephaly or macrocephaly? I'm gonna ask you a lot of questions, okay? You better answer me because the exam is very near. You should know. Yeah. So can you please tell me, do you see microcephaly or do you see macrocephaly in a case of Cry-Duchar syndrome? Exactly. You will see micro, छोटा होता था ना? Everything is short, right? Short. So microcephaly. So microcephaly, developmental delay, 5p gene deletion, high pitch cry, resembling like a cat. Cry-Duchar, no? Cry means cat. High pitch cry, resembling like a cat. That also you should know. Next, Klinefelter syndrome. What is the chromosome? What is the karyotype basically of the Klinefelter? Can anyone tell me? Klinefelter basically a male with a small testes, gynecomastia, hypogonadism, है ना? Low testosterone level. The treatment was testosterone therapy. We have done this previously already. Yes. Yeah. Hmm. Yes. Yes, exactly. So 47XXY. Yes, the karyotype in a case of Klinefelter syndrome is 47XXY. So 47, not 46. Okay, very good. Turner syndrome. Okay, Turner. Okay, yes, Turner. What should come to my mind if I'm revising Turner syndrome, my dear friends? What should come to my mind? कौन बताएगा? Anyone? Shagufta, Osama. Yes, hey, a female with a webbed neck, yes or no? A female with a webbed neck with a widely spaced nipples, yes or no? Female with a webbed neck with widely spaced nipples, and the karyotype is 45 XO, 45 XO. A female with amenorrhea, like मोती की तरह है, मोती की तरह ये points बहुत clear होने चाहिए. Very beautifully, this point should be very crystal clear in your mind. A female with a webbed neck with widely spaced nipples with shield chest, she cannot have babies, she'll have amenorrhea. And what else? Streaking of ovaries, that's why she'll not have babies. And what else? Because streaking of ovaries, she will have high FSH and LH levels. Yes or no? Am I making sense to you? You're right. Very good. So nice. For Raj already answering. Horseshoe shaped kidneys, yes. Let's just back to back remember everything. Yeah, cystic hygroma also is seen in Turner syndrome. And the most common congenital heart, the most common congenital heart in Turner is bicuspid aortic valve. And most common cause of death, yes, the most common cause of death in Turner is coarctation of aorta. Coarctation of aorta. Coarctation of aorta, Shubhangi Kaushik. What is the X-ray finding? Can you please tell me the X-ray finding of coarctation of aorta? एक बच्चा एडमिट किया यार. I have admitted one baby of coarctation of aorta. I am thinking what I should think in the X-ray and how the baby should clinically present. Who will tell me? Hmm. Yes. On the X-ray, you will see figure of three appearance. On the X-ray, you will see figure of three appearance. Very important. And where do you see figure of eight appearance? Yes, figure of eight appearance you will see in yes, figure of eight appearance you will see in supracardiac TAPVC. एंड फिगर ऑफ थ्री अपीयरेंस यू विल सी इन कोआक्टेशन ऑफ एओर्टा. अच्छा, क्लिनिकली बच्चा कैसे प्रेजेंट करेगा? कौस्तुभ इज आस्किंग सर आप कौन से कॉलेज से हैं? आई एम फ्रॉम हिंदू राव मेडिकल कॉलेज, आई एम वर्किंग एज असिस्टेंट प्रोफेसर. एग्जैक्टली, फिगर ऑफ एट अपीयरेंस यू विल हैव. बिल्कुल फीकी, बिल्कुल फीकी, जस्ट फीका. Yes, figure of eight appearance. So remember figure of eight appearance, Arpita. Remember, dear, figure of eight appearance on X-ray. Don't say TAPVC. You will say supracardiac TAPVC. Because infracardiac TAPVC will have a whiteout lung, and supracardiac TAPVC only will have a figure of eight appearance. And figure of three appearance, yes, figure of three appearance. You will see coarctation of aorta. मुझे ये किसी ने बताया नहीं. डॉक्टर ओसामा, डॉक्टर ओसामा, डॉक्टर साहब ये बताएं ब्रो दैट दिस coarctation of aorta, no bro, coarctation of aorta, one baby I have admitted, bro. So Dr. Osama, how will you clinically tell that this baby is having coarctation of aorta? Can you please tell me any one important highlighter, my dear friend, my dear brother, that of coarctation of aorta clinically? कैसे? Because nowadays in NEET PG they are asking proper scenario based or reasoning based question. No cramming business. You need to know that what happens and how the child will clinically present. Very, very, very important. किसने answer? Who told the right answer? Shagufta. Okay. Ayushi Gupta. Very good. Cyanosis is right, but most importantly, dear, do you remember aorta? Yes or no? Aorta. This is the ascending aorta. This is the arch of aorta, and this is the descending aorta. And here is the coarctation. here is the coarctation. There's a blockage, coarctation. So most importantly, the blood from the upper limbs will not able to go to the lower limbs. So too much of blood basically in my upper aorta or the upper segment of my body. So can I write bounding? Can I write bounding upper limb pulses? Can I write bounding upper limb pulses? And can I write very feeble lower limb pulses? Yes, bounding upper limb pulses and feeble lower limb pulses. Number one. Number two, yes, can I also write change in the blood pressure? Yes or no? There's a discrepancy, or I would say there's a change, there's a difference in the blood pressure of the upper limb and blood pressure of the lower limb. Very importantly, yes. Okay, done. Is everyone understanding? Am I making sense? Yes or yes, yes. Please tell me. समझ में आ रहा है ना? Exactly. And very, Dr. Osama, a question to you again. If this patient comes to me after 6 months, if this patient comes to me after 6 months, do I have any special finding which can be a part of coarctation of aorta? Yes. So, Dr. Kritika Subramaniam, what do you think? After 6 months, this patient is coming to me, guys. It's a proper MRCPCH question. Anyone applying for MRCPCH must answer this question. Dr. Osama, anyone. What is the what do you called after 6 months of life, there's a specific highlighter, specific point I would like to know. Ara Nisha, she says high blood pressure, but dear, high blood pressure so you will find within 2-3 days only. If the first time the patient has come to you of coarctation of aorta, you will see figure of three, you will see change in the blood pressure of upper and lower limbs, you will see bounding upper limb pulses and very feeble lower limb pulses. But if this patient comes after 6 months of life, after 5 months of life, do we have any specific amazing finding of specifically of coarctation of aorta? Anyone? Okay, no problem. I will tell. The answer is very important. Inferior rib notching. Very, very important. Do you see rib notching in a case of coarctation of aorta? So basically the ribs are there, no? The ribs basically. So there is a notching, there is a notching, there is a notch, there is a defect or a problem or a notch forms in the rib. Very, 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 very important. Why, sir? Because it takes time. It takes time. Inferior rib notching, basically it takes time to develop. Remember that inferior rib notching takes time. You don't see in rib notching suddenly within 1 month, within 5 days of life. Rib notching is a chronic late manifestation in a case of coarctation of aorta. And why do you see rib notching? Because collaterals are formed. There is a formation of collateral because there is a coarctation. No, the blood is not able to go down. That's why our body forms collaterals. Our body forms collaterals. That's very important that you should know. Is my voice coming to everyone? Yes or no? Please let me know. 1 second, I'll just check. I think it's coming only. Yeah, it's coming. No, my voice is coming. Is my voice coming to everyone? Say yes or yes, yes. Perfect. Done. Yeah, that's it. And very importantly, that what kind of cephali do you see, what kind of craniosynostosis do you see in a case of what you call Down syndrome? If I give you these four options, guys, what is the what is the craniosynostosis you will see in a case of Down syndrome? The answer will be brachycephaly. The involvement of the coronal suture, the involvement of the coronal suture is there in the case of Down syndrome, so you will see brachycephaly. I'll give you one chocolate, I'll give you one Ferro Rocher. मेरे पास पड़ी है. I got a new BMW, no? So this BMW people have given me a very big dabba of Ferro Rocher. Can you please tell me that do we have any other syndrome where there is specific coronal suture involvement, craniosynostosis? Do we have any other syndrome where there is craniosynostosis of the coronal suture? Anyone, any other than Down syndrome? कोई और? Do we have any other syndrome, or it's only Down syndrome? We have done this previously also. Osama, what do you think, bro? Cruzen syndrome. Have you heard of Cruzen syndrome? Osama, yes, bro. Yes or no? Cruzen syndrome is very important. कैसे याद रहेगा? How will I remember, sir? C for Cruzen syndrome, C for coronal suture involvement, C for Cruzen syndrome, C for coronal suture involvement. That also we need to understand. Let's finish this part now. This is clinodactyly. Everyone knows about it, I assume. This is nothing but, again, you know that this, what is this? Is nothing but brush field spots in iris. Brush field spots in the iris. That also we should know. We have done that part. And Muru reflex. Yeah, this is a very good question. Tell me, this is like a revision in my classes. We all revise. Tell me three important points where Muru reflex is absent. What do you think? Dr. R.R. Nishashri, Apna Nishi Agarwal, Osama, Shagufta, tell me three important points where Muru reflex is absent. Muru reflex is absent. Number one is, of course, Down syndrome, as we are studying Down syndrome. Do we have any two other conditions? So Nishi Agarwal says Erb's palsy. Is she right or is she wrong? Number one, very good, Nishi. I'm so proud of you. You are trying to answer, dude. Amazing. Amazing. You will clear. I'm telling you. Erb's palsy. People who always comment in the comment box, no, means they're participating. So their chances of survival, their chances of clearing the exam is very, very high. So there are some 40, 50, 100 students online. Try to participate. That's all I say. So, okay, Nishi Agarwal, if I say which is the most commonest cause of asymmetric Muru reflex. Are you understanding, Nishi Agarwal? If I say, dear, which is the most commonest cause, or tell me some important causes of asymmetric Muru reflex, then the answer will be Erb's palsy. So वो बात तो वहाँ खत्म हो गई. That point is finished there. Okay. Yes. Anything else also, Nishi Agarwal? Yes. So as you say HIE, so is HIE the right answer, Dr. Osama Swara? It's a revision segment, right? So Dr. Osama, do you see absent Muru in HIE? Is this line Kamala, is this line true, or do we need some bifurcation, some changes in this line? Very good, Shubhangi Kaushik. HIE stage 3. Yes. In HIE stage 3, you will see only absent Muru. Why, sir? Because in stage 1 HIE, what do you see? In stage 1 HIE, you will see exaggerated Moro. You will see, this is an exam question, my dear friends. We all have to clear this exam, this attempt only. Enough of repeating again. Finish this in one attempt. Study nicely. Little, do a proper timetable. Finish it off, please. How many times, how many months you will wait for the next turn to come? Next is coming next year. Again, you want to give. Finish it off. Be truthful to yourself and finish it off with your preparation. So, what are the three important points where you see absent Muru, Down syndrome, HIE stage 3, and what else? Kernicterus. Yes or no, Osama? मैं सही बोल रहा हूँ bro, गलत बता रहा हूँ? Am I saying it's right, bro? So Down syndrome, stage 3 HIE, and Kernicterus, you will see absent Muru. And exaggerated Muru, guys, stage 1 HIE, you will see exaggerated Muru. And any one more condition, who will tell me, Osama? Other than a stage 1 HIE, where else you will see a exaggerated Muru reflex? Anyone? Exactly. The answer is hypoglycemia. Hypoglycemia. Very important. Exactly. Perfect. Thomas is right. Osama is right. Shagufta Praveen. Perfect. Okay? Okay. Zainab Akhtar is saying cerebral damage. If Zainab Akhtar, if I ask persistence of Muru reflex, normally when does Muru disappears? Who will tell me? Osama, I forgot, yaar. Please, can you tell me when does Muru reflex disappear? Hmm. Don't mind, I'm having water. My health is not good, so I must finish a lot of water. Yes. So Muru reflex disappears by 6 months. Muru reflex disappears by 6 months, and if persistence of Muru is seen in cerebral damage. So if a 8-month old baby showing Muru, 12-month old baby showing Muru, the answer is cerebral damage. Finished, done, perfect. So Muru reflex is absent in Down syndrome, which is the most common GIT abnormality. एक दूसरे की तारीफें मार रहे हैं सब. Very good. वो क्या करिए? शगुफ्ता कह रही निशी को. निशी very good. निशी कह रही शगुफ्ता को. शगुफ्ता very good. That's cute. Yeah, we all are one family. We all must clear exam and help each other. Okay, that's important. Okay. Yes, exactly. So yes, we have Dr. Neil, which says, sir, kindly give how to become such optimistic physician like you. Where you get such energy? Okay, so where I get such energy? That's a very nice question. So where I get such energy, I tell you very frankly, a hidden secret. I take lot of milk. One glass of milk in the morning, one glass of milk in the night. Number one. Number two, very importantly, almonds. I take 10 almonds per day. Okay, in the night, my father he भिगो की इंग्लिश क्या होती है भाई, मुझे तो इंग्लिश नहीं आती। मेरे पापा भिगोते हैं रात को एलमंड्स को, और सुबह हम भीगे हुए एलमंड्स खाते हैं। इसका इंग्लिश क्या होता है? भीगे हुए एलमंड्स का इंग्लिश नहीं पता मेरे को। शुभांगी, कैन यू प्लीज टेल मी भिगोने की इंग्लिश क्या होती है? सोका। Yeah, so my father soak almonds in the overnight, and morning we guys have almond. I take 10 almonds because I go to gym, ठीक है? And third, very very important, as this All India rank 7 girl, she told me actually. And yes, yes, Thomas, you're right. So All India rank 7 girl, what she told me, like frankly, I liked her. Number one, she said meditation. Actually, meditation plays a very important role. Your mind should be in center. She told me one very important trick. He said, Anand sir, like if the students who are preparing for PG exams, FMG, INI, CT, and NEET PG, tell them to control your heart rate. Control your heart rate. Number one, you guys get panic, right? During the exam. Stress, frustration, panic, tachycardia. We start forgetting whatever I have read, that only I'll forget. Oh my God, I'm getting stomach pain also. I'm getting diarrhea also. I'm forgetting so much. I'm so stressed out. That's what. Control your heart rate. She told me, Anand sir, I do a lot of meditation, and most importantly, control your heart rate. And that doesn't mean every one of you should do meditation. Meditation, actually, some people like to do, some people don't like to do. The moral of the story is control your heart rate. Like nothing should affect you. You should be immune. Like try to control your heart rate. Like I can only say this thing. Someone left you in life, relax, control your heart rate. Someone came in your life, control your heart rate. Someone expired, control your heart rate. Someone came in, control your heart rate. Control your heart rate, control your vibes. That's how she got rank 7, because in the exam, the beginning 10-20 questions she was not knowing at all. She said मुझे आते ही नहीं थे. She said I thought I'll fail, but I controlled my heart rate, and I was like, it's okay. Five question I don't know. No, sixth I will know. Okay, sixth also I don't know. Okay, seventh I'll know. So after 20 question, rest all questions she knew. So and she got rank. So that's what this is the nice. And most importantly, yes, any one physical fitness. Even she also told that she plays badminton in the evening for 30 minutes. So frankly, I'm telling you, my brothers and sisters, that at least one hobby. Frankly speaking, I have my one of my junior. He's a AIMS topper, and even one day before the AIMS exam also, he had gone to gym because he likes to go to gym. That doesn't mean you go to gym. That means that you must have, every one of us must have some physical fitness, some physical exercise. Maybe playing badminton, maybe running, maybe skipping, something that energizes your mind. I came back from gym. Just now I came back from gym, from 1.5 hour of gym. I came back. I'm so enthusiastic. And today was my leg exercise. And I have, I have put 250 kg, 250 kg मैंने उठाया है leg press में. There's an exercise called leg press where you lie down and thighs, you make thighs like that. So 250 kg. That's like hugely insane. But see my energy now. So that is one my segment of evacuating my energy. This is one segment of my life of vacating. Are you understanding? Are you understanding? Vacating my negative vibes or my energy, basically. So it's a recent article. It is self proven. People who are multi talented, or people who are usually toppers, they use multiple areas of brain in a way, like they are multi talented. People who only study 24/7 study, they get average marks. But boys who goes to badminton, who plays volleyball or football in the evening for 1 hour, and then come back and study, their chances of getting a rank 1 is very very high, because they have vacated all the energy. They are full fresh, they are energetic, they are ready to roll, they are ready to rock and roll. And that's how the thing is. Yes, exactly. Yes, so Raj says, yes sir, I'm doing meditation, it gives me refreshment of inner soul. Yeah, I'm telling you very frankly, like I have also just started. One of my friend is there, he is doing MCH, so he's a surgeon. His name is Hemant, a very wonderful person. So he has got a he has got a big, I don't know, some mark he has got over here by doing meditation. He's like, you have to, like, you might guys might be knowing, he said that everything in the center, think over here, like that's what they say in meditation. Imagine, just focus here. And I can't focus at all. He's like, focus here, and he does very good focus. And once it becomes a part of life, it's awesome. The most common GIT abnormality in Down syndrome is duodenal atresia, and everyone knows about it. Where do you see single bubble sign? We have done this multiple times. Exactly. So single bubble sign basically you see in congenital hypertrophic pyloric stenosis. Everyone knows about it. Yes. And where do you see double bubble sign? Very beautiful picture, my dear friends. Double bubble sign is seen in duodenal atresia. Double bubble sign could be a very straightaway PG question, very straightaway image based question. Okay, and you'll be thankful then. Okay, thank God we saw the picture. Photographic memory, remember that. Exactly. Yes, exactly. So what you called the most common GIT abnormality in Down syndrome is duodenal atresia. How will I remember, sir? D for Down syndrome, D for duodenal atresia. The most common GIT abnormality in a case of Down syndrome is duodenal atresia. And where do you see triple bubble sign? Exactly. Triple bubble sign you will see in jejunal atresia. You will see triple bubble sign. ओसामा को अच्छे से रटा हुआ है, एक लाइन ओसामा को पता है. Osama is answering so well. CHPS patient, projectile. You remember, right? Everyone knows about the CHPS, right? What kind of vomiting do you have in congenital hypertrophic pyloric stenosis? Can anyone tell me just one single line answer, one beautiful single line answer? Can anyone tell me? I am having pyloric stenosis, right? What kind of vomiting will I have in, what is the proper metabolic abnormality with the vomiting profile? Can you please tell me? Hmm. Exactly. You will have projectile, profusive, postprandial, non-bilious, vomiting, followed by voracious appetite, and what is the ABG finding? Hyponatremic, hypokalemic, hypochloremic, metabolic alkalosis with paradoxical aciduria. With paradoxical aciduria. This is the perfect finding of CHPS patient. And if you're a newcomer, my dear friends, please watch my video on CHPS. It's a proper 1 hour topic I have done on congenital hypertrophic pyloric stenosis. So projectile, profusive, non-bilious, vomiting, and postprandial, खाना खाने के बाद after meal, vomiting with voracious appetite. Baby vomit, he's very hungry, he cries, he again feed, again vomit, he's very hungry, cries, and again he feeds. Like that it is done. Perfect. Yeah. Most importantly, males are always infertile in a case of Down syndrome, and in Down syndrome, the IQ is decrease. The IQ is affected. The IQ is decrease in a case of Down syndrome, and where the IQ is will be normal. With syndrome, the IQ is normal. Everyone knows about it. A female with a webbed neck, the IQ will be normal. This part is over. Exactly. Yes. Why there is aciduria? It's a very long explanation, bro. वो हाइड्रोजन आयंस होते हैं, रास एक्टिवेट होता है, बहुत लंबा चौड़ा है. Just watch my that video of CHPS, bro. I have told that why there is paradoxical aciduria. Like in the stomach, in the ABG, it is metabolic alkalosis, but in the urine, it is aciduria. So alkalosis, aciduria. Paradoxical means opposite. Here above there is metabolic I'm vomiting. All my acid has gone out, so I am having metabolic alkalosis in my arterial blood gas analysis. But in my urine, I will have aciduria. So alkalosis and aciduria, known as paradoxical, opposite, right? Paradoxical. Why aciduria? Again, it's a long proper explanation I have told in the videos in the previous ones. Hydrogen ion secretion is there and RAS get activated. Please watch that video. That's all I can say. This part is over. Okay. Let me ask you. Let's just what do you call it? Yeah, which is the most commonest cause of Down syndrome? Last 2 minutes and this class is over. 9:30 p.m. Let's meet everyone in the cardiology section. Exactly. Yeah, which is the most common cause of Down syndrome? Everyone knows about it. The most common cause of Down syndrome is nothing but meiotic non-disjunction. Sir, what is the meaning of meiotic non-disjunction? मेरे को तो समझ, I don't understand what is meiotic non-disjunction. So everyone knows, right? How many, one second, how many chromosomes are there in a cell? How many chromosomes are there, dear? How many autosomes are there and how many pair of chromosomes are there? Osama, Nishi, Shagufta, Swaraj, and Mohammed Fahim. Yes, and Farhaz. Exactly. So we have total 22 pair, like 20, 21, 20. So we have 22 pair of autosomes and one pair of sex chromosomes. So there are 23 pair of chromosomes. There are 23 pair of chromosomes, 22 are autosomes, and one pair is the sex chromosome. This is the normal thing. Okay, this is the normal thing. Whereas, very importantly, this one, can we appreciate this one? Here, the chromosomes are splitting into two. Here also chromosomes are splitting into two, and here also chromosomes are splitting into two. But can we appreciate, my dear friends, that chromosomes are not able to get split into two? So this is nothing but like a non-separation. Two chromosome came here only. So this is known as meiotic non-disjunction. Non-disjunction matlab means chromosomes don't split apart. Chromosomes are not splitting. Okay, chromosomes are not splitting. Again, PG entrance question, which is the most commonest cause of Down syndrome, the answer is non-disjunction, means chromosomes are don't split apart. Chromosomes don't split apart. That is one thing you need to know. And yeah, trisomy seen in Down syndrome, FMG November 2017 question. Trisomy seen in Down syndrome is trisomy 21. This part is over. Exactly. 95% cases, the cause of Down syndrome was meiotic non-disjunction, whereas 4% cases, the cause is translocation. 4% cases, the cause of the what you call Down syndrome is translocation, and 1% cases, the cause is mosaicism. Mosaicism, that you should know. Okay. And very importantly, what is balanced translocation? If I'm having balanced translocation, means all the babies will have 100% chances of Down syndrome. If I have a balanced translocation means all babies will have 100% chances of Down syndrome. Like we have a MCQ here, very nice MCQ, AIMS question. It came in AIMS. Can you please read this one and please tell me what is the answer? What do you think? Yes. Neil, koi baat nahi, bro. Automatically it will come. Just do the good work, Neil. That's it, okay, bro? So doesn't matter, buddy. Take remember that, okay, Neil? So yeah, yeah. So can we appreciate a 35-year-old lady with chromosomal translocation? With chromosomal translocation 21 by 21. Now this is known as balanced translocation. So the risk of Down syndrome in the child will be 100%. It was an AIMS question. Please इसको याद रखिएगा. अच्छा, this is the last question. This is the last question of the slide because we have to go for the audio sessions also, bro. So can you please tell me read this question. It's a very nice question. See, AIMS people, no, they ask very good questions. I like AIMS questions. They are very smart questions. It's a very good question. Please, can anyone please read this question? This is the last question for today's class, and let's see if you can answer. And don't mind, I'm having water. My health is little not okay, so I must have water. Mm. Exactly. Very good, very good, very nice. Yes, it's a very important question. One of the parent who have a child with Down syndrome have a balanced translocation between chromosome 15 and 21. What advice will you give to the couple to prevent the child being born with Down syndrome? So I will advise them for the prenatal diagnosis and I will advise them abortion. I advise them abortion. Yes, yes, Osama Sheikh. Yes, yes, bro. Okay, this is important. That's it. Okay. Yeah, that's it. That finishes today's class because otherwise, the class only will never get over. Okay, yes, that finishes today's class. Thank you so much, everyone, for this wonderful participation. And it's 9:30 now. Now our audio class is starting within 5 minutes. I want all of you to come to our audio class. The topic of choice will be cardiology. मेरा वो फोन कहाँ है? एक सेकंड एंड्रॉइड वाला एक सेकंड हाँ एग्जैक्टली so yes, before leaving, we always have a quadruple scan. देखना है तेरे को. So तेरे को पता है ना quadruple scan. So inhibin A is a part of quadruple scan, bro. You know that, right? So yes. So very good. Let's start our what you call audio class within 5 minutes. So and before leaving, we always have. नहीं, ठीक है. दाल हाँ दाल खाऊंगा 5 मिनट में आता हूँ. ये तो यहीं दे दो थोड़ा सा. नहीं नॉर्मल बस नॉर्मल. ठीक है अच्छा दिस वन व्हाट यू कॉल्ड या व्हाट आई वाज सेइंग हाँ सो हाँ बिफोर लीविंग वी ऑलवेज हैव अ मोटिवेटिंग कोट एंड दिस इज अ वेरी ब्यूटीफुल कोट व्हिच आई लाइक ही हु डज नॉट होप टू विन he who does not hope to win has already lost he who does not hope to win has already lost So very important. This is like a self-explanatory picture message to everyone. Write in your notebooks, okay? He who does not hope to win has already lost. So will you win? The answer is yes. Will you get a PG seat? What do you want to answer? Do you want to answer, sir, I'm trying, sir. I think I have revised, but like that you want to answer? How do you want to answer? Will you get a PG seat? Will you get a PG seat? You will say, yes, sir, definitely. There's no doubt on this planet that I will not get the seat. I will. I was born to get the seat. Positive attitude will lead to positive results. Automatically, you will have a positive attitude. अभी तो ये दे दो. So he who does not hope to win has already lost is one of the very important this one. Exactly. Yes, 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 very good. So yes, so we're gonna end this. Itna kafi hai. So we're gonna end this session. Thank you so much everyone for this wonderful participation. Let's come back on the our audio class, and let's revise cardiology within 5 minutes. I've got my Android phone, and yeah, let's finish the session on the Android in the audio class. It's only for the Android users, not for the iOS update is on the way. Thank you so much everyone, and remember, he who does not hope to win has already lost. So do you hope to win? You don't hope, you will win. You will win. You will win. Remember that, you will win. Okay, remember, आओगे तो welcome, जाओगे तो he'd come. Remember, okay? And you have nothing to lose. You have nothing to lose in life. You have got this. You have got the whole life. You have nothing to lose. People will lose you. You will not lose people. Someone going away from your life, it's their loss, not yours. No, don't go. Oh, ho, ho, I'm missing you. Cut that pravachan. Be self-independent. It will be nice for you. Thank you. Bye bye. See you in the audio class.